I'm here today with Patrick Lappert, and I am so delighted to be here with him. I met Patrick in Alabama as he was testifying on some legislation to prevent doctors from medically transitioning children. And he gave such compelling testimony and had such insights about what's happening with children that I'm so excited to get a chance to talk to you, Patrick. And
Thanks, Aaron.
the first, I guess, I don't know if I said you're a plastic surgeon and
Right,
you've been really outspoken about this issue.
right.
And my first question for you was that one of the things that you mentioned in Alabama is that if a patient comes in and asks for plastic surgery, that your job is to first assess to make sure they're mentally competent to make a decision about that kind of surgery. And I was wondering if you could just explain that a little bit.
Sure, sure. Well, first of all, one of the misapprehensions that many people have about plastic surgery is that it's just cosmetic surgery. So um, this it's sort of gone back and forth over the years, but we call ourselves plastic surgeons, but it really means plastic and reconstructive surgery. The reconstructive side of plastic surgery is where most of us spend most of our time. Generally, you'll find that as plastic surgeons have been in practice for years, and they sort of moved out of the reconstructive side of things, they move into the sort of the easier, easy pace, aesthetic side of things. But the fact is that reconstructive surgery, plastic surgery, always balances aesthetics with function, because that's what human reconstruction is about. You're not just trying to sort of tack something back on and hopefully it's going to work kind of thing. You're always balancing form and function. And so and that's also the case when people come to you with aesthetic complaints, because one of the things to understand about aesthetic surgery is that it isn't just about vanity. People think that aesthetic surgery is just something vain that people do. They want to, look ridiculously beautiful or something like that. The majority of people who come to a plastic surgeon for aesthetic surgery have something visible about them that causes them a daily kind of grief or problem. A typical complaint is, in fact, I just had this patient yesterday. She comes in, she's just turned maybe 41 or 42 years old. She works in the public. She works with a fairly large group of people, but within that group of people, she has some friends who she's been hearing the question, are you getting enough sleep? Are you getting enough sleep? So she's having to excuse her appearance all the time. She feels fine. She's getting plenty of sleep, but her face looks tired. And so she came to me asking if there's anything that I can do so her face doesn't look so tired. Well, there is. It's some simple things I can do, and in the office, very simple, very low risk, and it solves a problem. Okay, and so that's what aesthetics means. Aesthetics means feelings, right? Anesthesia means taking away somebody's feelings. Aesthetics means how what you see affects the way you feel. And it's the case that when you see another person, you have an aesthetic response. And sometimes that aesthetic response is a repetitious and annoying thing that the person has to deal with. The boy with very prominent ears who hears about it every day on the playground. You can fix that without too much risk at all. And he no longer has to think about his ears. He can get on with the life of being a 7-year-old boy. So, but sometimes people will come to a plastic surgeon and they'll have what sounds like an aesthetic complaint. uh, you know, Doctor, I would really like you to change the shape of my nose because it's a horrifying thing, and it's constantly drawing people's attention to my nose, and I know it's interfering with my social life. And as you're listening to the patient's complaints, you get the sense that what they are seeing and what you are seeing are two entirely different things. That there's something at work in this person's heart, that there's a wound there, and they're looking for a physical explanation for why they feel the way they feel. And it's natural to us as human persons because we are incarnate creatures, right? These hylomorphic soul body unity, one thing there. And so the way we feel about things and the way we look at things are sort of meshed together that way. And it is the case that when people have wounds, very often they don't want to look at them. The image that I have is the classic image for me is when a child comes to my plastic surgery office with a wound that they might have gotten, say they got bit by a dog, or they fell off their bike and injured their hand or something like that, and they come with a bandage on it. There's a bandage on that part. And so one of the things I have to do is gain their confidence, but then I have to take the dressing off, and we have to look at the wound. And the child does not want to see the wound. They're happy that the wound is covered up. They're happy that they don't have to look at it. It's not hurting right now, and they don't want you to look at it, because if you're going to look at it, that means they got to look at it, and they don't want to see it. And that's a natural to us. It's natural to us to be that way. And so sometimes a patient will come in and they'll have an interior wound in their heart. Something has happened to them, typically in childhood, typically in family life. And it's affected the way that they interact with other people. And there's a lot of unhappiness. They have difficulty forming long-term relationships. They have difficulty being, in the present moment with a loved one. But they don't want to look at that wound. They don't want to look at maybe that episode of abuse that caused the wound, or whatever it may be. But they need to understand it. They want an explanation, and they think it's my nose, or it's my breasts, or it's my whatever. And so they want you to change that. And so the hint that we as plastic surgeons will get is when they're describing something that is profoundly life inhibiting or altering, and you can't see it. They're describing a nose that's like hideous. And I know that the reason why I'm never getting any promotions and I have such difficulty, forming relationships with women is because this nose of mine is so hideous. Would you please change it? And so that's a defined condition that we as plastic surgeons, when we're in training, we have to learn about that. We have to learn to understand the patient's motivation, because if you operate on somebody with that condition, you're not doing them any service, because you're not addressing what's really wrong. They'll be happy for a while, there'll be some excitement, but then the excitement dies away. Their friends stop saying, "Oh yeah, that your nose looks really cute," and then they stop hearing comments about it, but they're still unhappy. They still have the wound, and then they'll come back and complain that you didn't do the right operation,
Or
and
that
then
my ears are too big.
or something. Yeah, it's
Something
like
else.
initially they're elated, and then the excitement goes away, and then they want more surgery. But, in the history of our generation, Michael Jackson is one of the most classic examples of this. It's called body dysmorphic disorder. And body dysmorphic disorder is a subcategory. It's a subcategory of obsessive compulsive neurosis. And what it is it's the person will have an obsessive thought that leads to a compulsive behavior that they use to manage an interior anxiety. And in this case, what they attach that compulsive thought to is something that doesn't really exist. Among the classic ones is the person who's obsessing about germs on their hands, which these days, of course, it's a tough one to gauge. But anyway, they're constantly getting up, imagining that they're covered in life-threatening germs and constantly washing their hands. Really, what it's an expression of is an interior anxiety, but they develop this obsessive thought. Right? So there's an obsessive thought that leads to a compulsive behavior. The one that's easiest for people to comprehend is the anorexic female. It's usually a late adolescent, early young adult female who has an interior wound, a tremendous anxiety, who imagines that she's obese, and if she would only lose weight, she would have more friends, she would have more meaningful relationships, she would have more long-term relationships, maybe even a love interest that could develop if only she wasn't so fat. Well, you look at the typical anorexic and they're skeletal, right? But in their mind, they have this obsessive thought that they're obese. So it leads to compulsive behavior. In the case of the anorexic, the compulsive behavior is purging after they eat or something like that. And it gets to the point where they can't keep any food down. They start losing weight, but they still see obesity. And they'll actually come to someone like me, they'll come to the plastic surgeon, and they want you to do liposuctioning on them. They think that this little roll of soft tissue in their belt line is the reason why they look so fat. And you look at them and their body mass index is some number less than 10%. And by definition, that means that they're malnourished practically. And but you can't convince them of it. It's in the nature of obsessive compulsive disorder that the obsessive thought is not a true thought, right? And so that's kind of the diagnostic criteria. So in the case of transgenderism, for example, it's not that they're obese, it's that their sexed self is wrong, right? So it isn't the shape of the nose or the weight or something like that. It's the outward appearance of their sex. The fact that the young girl sees breast development, and she's convinced that if she wasn't seen as a female, that she would be safer. There's oftentimes there's issues of personal safety associated with transgender thoughts. It's a family dynamic typically, but it's the same process. It's the same process. It's a way of managing the anxiety by ascribing the anxiety to your appearance. And so they'll start binding their breasts. They'll start doing things to themselves to make themselves look less female, thinking that if they look more like males, their life would be better. And then sometimes they'll even get to the point where they actually think, they actually imagine that they are, in fact, boys in a girl's body.
Which is really easy to do if you've got teachers, parents, and other experts telling you that it's possible to be born in the wrong body. And
Right,
that's where I feel really lucky, because when I was a little kid they called it gender identity disorder back then,
right,
I did not have people telling me I was indeed born in the wrong body, thank goodness. I had therapists who were able to identify the cause of my gender dysphoria, the cause of my trans identity. But nowadays, you have people telling kids like me saying, yeah, you're right. It is possible to be born in the wrong body, which to me is akin to telling that person with the big nose that you're right, your life will be all better if you just get the nose job, or
right,
telling the anorexic, oh, you're right, you are fat. If we just get rid of that little tiny
right.
extra fat,
Yeah.
your whole life is going to be better.
And in every other case, that would be considered malpractice. If the American Society of Plastic Surgeons, the American Board of Plastic Surgery, were to get wind of the fact that I'm liposuctioning anorexics, then they'd be reviewing my cases and they would probably withdraw my board certification, right? But when you apply it to this whole gender theology, this whole gender ideology, suddenly all bets are off. And at the heart of it is this delusional thought. Okay, so we use the term delusion not as an insult. It's not a pejorative term. Delusional thinking is an actual phenomenon in the human mind where the person has this fixed, firm belief in something that you cannot dissuade them from it, right? They're absolutely convinced of this idea. You present them with the objective truth, and they'll nod like they're hearing you, but they will not believe it, right? And so that's the two criteria. The third criteria is what they believe is impossible. So those are and those criteria have been in the world of psychoanalytic literature since 1917, 1913. I forget the textbook of psychiatry, but anyway, so it's a fixed, firm belief that cannot be dissuaded with objective truth, and it's impossible. Well, the public conversation we're having now is, well, yeah, the transgender person is persistent, is insistent, and consistent. That's what they call the diagnostic triad for transgenderism: insistent and consistent. Well, that's delusional thinkers think that way, right? What the argument we're having in public now is, yeah, it's possible. It's possible, they're saying, that a person who has a Y chromosome in every somatic cell of their body could in fact be a female. That a person who has male gonads, right, as a result of having a Y chromosome, who has testicles, could in fact be a female. And so all of this is based on this insane idea that the human person is actually a spirit being that may or may not be occupying the right body. Okay, I'm going to just sort of stop here and say, I've been a doctor. I've been in the world of medicine for about 41 years now. I've been a plastic surgeon for about the last 35 years, give or take. General surgeon before that. Done a lot of reading, read a lot of textbooks, board certified 3 times, Never in my entire professional life did I ever read a single sentence or hear a single lecture or hear anyone propose that the human person is actually a spirit creature that occupies a body, and they actually may be occupying the wrong body.
And that's so intriguing to me. What does
Where did
that
it come from?
mean?
Yeah, what does that even mean? What does that even mean? And people with MDs after their names will actually say that to you with a straight face. They're usually selling a transgender surgery or transgender medicine, but they'll actually speak in that language, and they will help patients, particularly young people, to rehearse that kind of language. They'll teach that kind of language to pre-adolescent children in public school. They'll give them literature to read, where it gets them thinking that it's in fact possible that you were quote unquote assigned male at birth, as if it was something arbitrary, as if it
As
had
if
no
the
basis in
doctors were
reality.
so, the
Yeah,
doctors just capriciously sort of said
sure.
male
Yeah,
and
hey,
female.
we got a quota to meet here. We haven't produced enough
Yeah,
males, so
it's
you are going to be a
very
male.
strange.
Yeah, it's bizarre. It's absolutely bizarre. But we're giving that sort of literature to children and getting them to think about their sexed self in terms of an interior, as nothing more than the fulfillment of an interior desire or a way to quell an interior anxiety, right? What we've done is we've totally separated human sexuality from its reality, okay? At the heart of the nature of the human person is the fact that the human person cannot be understood. You cannot understand what it means to be a human person if you're just looking at one isolated individual, because our very bodies speak to the fact that we are made for the other. Our genitals do not explain themselves. Our heart explains itself. Our heart explains itself as this muscle that pumps blood and delivers oxygen and nutrients. Our lungs explain themselves because it's a gas exchange organ. Our guts, the nutrients and all this kind of stuff. If you were to pick one isolated human person, visitor from another planet, you'd get to their genitals and you wouldn't have an explanation for what those things are unless you have the complementary other. So the fullness of the understanding of what it means to be a human person, you can't get unless you have a male and a female. It explains, first of all, how their bodies are made. It tells us that we are made for the other, right? And that self-donation to that complementary other is where human life comes from. And that
It's
has been the
basic biology.
basic biology. Yeah, exactly. And yet what we have taken, what is at the heart of our understanding of medicine, biology, science, take it all the way back to Aristotle, take it beyond Aristotle, take it to some farmer 5,000 years ago, somewhere in Syria. They knew these things. These are basic realities of life. And yet, suddenly we have put all that aside. Why? Because we're trying to explain certain political behaviors, the separation of our sexed self from our sexual life.
Well, and
We've
it's
separated.
really dangerous to do that with children because,
Oh my
first of
goodness.
all, we're talking to children about things that I don't really think it's appropriate to be talking about. We don't need to be talking about our genitals in kindergarten. But if you've got a kid that comes in and says they're transgender, then it opens up this whole bizarre discussion that kids aren't really mentally equipped to deal with because they need adults to reaffirm reality. And what's happening now is the adults are actually lying to them. In my view, it's a lie. So, what happens to you as a doctor when a child comes in and says, I was born in the wrong body, please help me? What is your responsibility as a doctor to respond to that child?
Well, one of the key things to understand about transgenderism or gender identity disorder, the vocabulary is changing all the time because that's part of the strategy, is to keep changing the words so that you keep giving people the idea that they're not smart enough to understand this.
Well, it
They're
also allows people to be the enemy because if you
correct.
make one mistake
Yeah,
in the politically correct vernacular, then they
right.
can attack you. And so,
That's exactly right. Yeah. So, but at what's happening though is the dynamic has changed. It used to be that among children who suffer with gender identity disorder, who have cross-sex self-identification. First of all, the lion's share of them, I think over 80% of them were boys who thought they were girls. And the long-term studies, particularly by the likes of Dr. Zucker up in Canada, have shown that if you just watchful waiting, raise these children as children ought to be raised, with loving family life and affirmation, always encouraging them to understand what is the truth, because the truth is where happiness lies, right? You raise them as your children. Over 80% of them will get over this cross-sex self-identification by the time they're in mid-adolescence. And if you follow them out into young adulthood, you're well over 90% of them have abandoned this cross-sex idea of themselves. But if you affirm them in that idea, as people are doing now in public education, in the media, so on, virtually all of them will persist in that idea because it's been turned into a heroic struggle. It's been turned into some fundamental self-identity that defines them in a heroic way, and it promises them future happiness. So children thrive on the affirmation of adults. That's how children are structured. That's how they learn. You know, they learn first of all by a sort of sense of adulation in this adult role model, and then when that role model is affirming them and telling them, boy, you are great and you are brave and you're going to have a wonderful life. Well, how could they possibly resist that? And so the case is that if you take those same children who otherwise would have abandoned this cross-sex idea and you take them to a gender clinic, virtually all of them will persist in that idea. So essentially what that's telling us is that more than 80%, probably closer to 90% of children who are being treated in gender clinics have been misdiagnosed.
And
Well,
can you talk about how profound that misdiagnosis is? Because I hear
oh,
that being transgender is a normal developmental path. That's what a lot of activists will say. And if it was just a normal developmental path that didn't require medical intervention, then it wouldn't be as concerning to me. But can you talk a little bit about why it is that it's not a normal developmental path and what happens to these kids?
okay. Well, first of all, in order to imagine that you're going to do anyone any good as a doctor, right? Whether you're a pediatric endocrinologist or a plastic surgeon or a child psychologist or anything like that, you have to understand, you have to make it your business to have the clearest, fullest understanding of the nature of the human person, right? That there is a natural truth, there's a natural order to things, right? For example, understanding how much oxygen blood can transport and measuring the hemoglobin content of it, and knowing that if a person gets anemia below a certain level, they're at risk of a coronary attack if they're over the age of 60. Facts. I'm talking about facts, the truth, the nature of the human person. You always have to begin with that. And if you abandon the natural order of things, if you abandon the natural truth of things, then you put the patient at risk. Okay, so now, why do I say that? I say that because medical care rests upon underlying understandings of the nature of the human person that is then examined in the office. A person comes in with certain complaints. You understand how the normal human functioning of the person ought to be. You see where the errors might be, and then you start asking questions. You start making diagnostic tests, physical examination, medical tests, blood tests, x-rays, what have you, so that you can arrive at a diagnosis. Okay, diagnosis is very important, obviously, to the right treatment of a person. If you miss the diagnosis, odds are you're going to be doing harm to the patient. All of this is pretty obvious, right? But we've abandoned that whole idea in the case of transgenderism. And why do I say we've abandoned it? Because there is no medical test. There is nothing that I can do to prove or disprove the condition when a child comes in and says, hey, you know what? I was assigned male at birth, but I'm really a female. If I examine them, I'm going to find a male, right?
Every cell of their body.
Yeah,
Every cell of their
exactly.
body.
I do a swab of their mouth and look at their chromosome count. I'm going to see 46XY. If I do hormonal studies on them, and they're above a certain age, their hormone levels are going to be testosterone level at this height. They're going to have secondary features of maleness, a narrow pelvis, the leg length to body length is going to be more masculine, a masculinized face, facial hair, all of those things, right? Those are all obvious clinical features of maleness and femaleness. But if somebody says, no, I'm transgender, I can't do a biomedical test to say, oh, golly, you know what? They really are transgender. Look, here is the androgen to estrogen ratio, or here is the certain receptor that determines that their brains are going to function like somewhere between male or female, or the cross sex, or whatever it may be. I can't do a blood test. I can't do a chromosome study. I can't do a hormone study. I can't do an X-ray. I can't do a dynamic brain scan that proves or disproves the diagnosis, right? So essentially what's happening is children are being submitted for profound medical interventions, most of them irreversible, and it's the child that's made the diagnosis. You're talking about a pre-adolescent child making this diagnosis, who's being affirmed in this idea by adults, who's being given puberty blocking drugs that are going to stunt their growth, that's going to stunt their psychomotor development, that's going to completely interfere with their psychosexual development, with their capacity to form interpersonal relationships that may lead to normal adult sexual relations of family life and things like that. We have absolutely no idea what this is going to cause. Why? Because we are now witnessing a public experiment. No one knows what puberty blockade is going to do long term to normal children.
And then when you add that to cross-sex hormones
Oh,
and surgeries.
It's completely off the charts. And so it begins with, first of all, a denial of the objective reality of the nature of the human person.
And it
Right?
also requires society to participate in this experiment without informed consent. None of us are asked if we're okay with participating in this experiment. And yet if we don't use the appropriate, preferred pronouns, if we don't affirm this child, then we're told that we're somehow harming this child. So it's like the whole society has been co-opted into this strange experiment, and we don't even have any idea where it's going.
Yeah, and it's politically driven. The language of all of this is politically driven, and all of the indignation if you use the wrong pronouns, all the legal intervention in the doctor-patient relationship, the idea that a child can consent to puberty blockade or cross-sex hormones, or mastectomy in the case of a 14-year-old girl. In no other area of medical care are children allowed to give consent. And yet, through the action of state governments, laws have been passed, and in Canada, you see this very much so, the laws have been passed that essentially empower children to make these decisions, which otherwise they wouldn't be allowed to make. Why? Because we know that under a certain age, people make some pretty stupid decisions, thinking that they're going to make themselves happy.
Well, and I can't even imagine how you get informed consent on something like this when we don't have longitudinal studies about what puberty blockers are going to do, what these cross-sex hormones are going to do.
Exactly.
How does a child even give consent to medical interventions when we have no idea what the long-term impact of those are going to be?
And even if the consent is put in the hands of the parents, you can't give the parents the
So
safety
what would
data
you
on
tell
it.
them?
What would I tell them? Yeah.
I
Well,
mean, if you were trying to
Mhm.
to explain what their child's what the
Right.
implications of these interventions were going to be, what would you tell a parent?
Well, a very important thing to understand about gender identity disorder is that it's a family dynamic. Typically, it's not something that happens in isolation. Although I started to talk about this earlier, but maybe we can get into this now. Is that there's a new phenomenon on the scene now that's called rapid onset gender dysphoria. And so, as I said earlier, it used to be, the history of it was that over 80% of children with cross-sex self-identification were boys who thought themselves as girls. And that amounted to like 0.03% of the population. Very unusual, and virtually always boys that thought they were girls. Well, all of a sudden, in the last 5 years, the numbers have reversed. Now 80% of people who self-identify as cross-sex are females who claim to be male, and they are late adolescent, early young adult, typically high school age or first or second year of college, and it happens in clusters or groupings of women, young ladies. And this was revealed, the first paper published on this was published by a Dr. Lisa Littman up at Brown University. And she demonstrated through surveys and things like that, how these women will form these online groups or on-campus groups and actually rehearse the language of what you need to say to the doctor to convince them to give you T, which is testosterone, or to convince them to refer you for mastectomy, or to convince them to they rehearse the language because they get one another sort of whipped up with the idea that their future happiness rests in the fullness of the expression of their inner self as being really male and not female. So you see these clusters. You'll see all of a sudden, in an 8th grade class that was just rumbling along with a normal academic year, suddenly 3 girls in that one class are transgender. Or you'll see an outbreak of it on a college campus. They'll be coming to the campus medical clinic demanding services. And the default position for medical care now in most jurisdictions is you have to affirm them in this idea, otherwise you risk losing your license. Pretty bizarre, yeah. So
It's extremely bizarre.
It's insane. So, but backing up to your question, you have to view it as a family dynamic, especially if you're dealing with a younger child. But you do not serve the patient. Nobody is served by being affirmed in a delusional thought. You don't feed a delusion, right? That does not serve the patient. Only the truth will set you free, and only the truth will heal you, right? Like the truth of the nature of the human person leads to right diagnosis. Well, the truth of the nature of the human spirit leads to right living. And if you deny the truth, essentially you're denying them human flourishing. And so
and you're also treating them for something that is fake.
Correct.
You're providing a medical intervention you're giving them really quite powerful medications and potentially surgery for something they don't need.
Correct. That's correct. There's some parts of this, there is some degree of reversibility, although the use of cross-sex hormones has some profoundly irreversible effects. Puberty blockade, we don't know what's going to happen. We know what puberty blockade does to children who have precocious puberty. That's a medical diagnosis. I can do a test on a 6-year-old girl who's developing breasts and go, this child has precocious puberty, and we have to block it. Otherwise, she's going to have skeletal abnormalities. She may be rendered sterile. She might have problems with hypertension, all kinds of things that you can predict because you understand the disease process. You give them puberty blockers, you're doing them a service. But
then you can measure the effect, so you know what's happening.
That's exactly right. But if you do the same thing to a normal child, we don't know what's going to happen. The use of cross-sex hormones in an adolescence, once they reach what's called Tanner stage 2, and they start giving them puberty blockade, cross-sex hormones, that will start having some irreversible effects. If you're giving testosterone to a 14-year-old girl, she'll start growing facial hair, her voice will get deeper, her muscle mass will increase, her aggressiveness will increase, all kinds of things will happen. Some of them are reversible, but a lot of them are not reversible. And then
it just makes me wonder, I'm thinking about this, and so if you had a patient come in who was anorexic and her parents were agreeing with her that she was overweight, affirming when she was actually potentially dangerously underweight.
Yeah.
What would you as a doctor do? Because one of my biggest concerns is that there are parents, and especially mothers, I'm seeing just like cheering their daughters on or cheering their sons on, and gaining a lot of, it seems like, community support. Like,
Right.
Yahoo, my child's transitioning. I'm so proud of them.
Right.
And so
They
as a
become
doctor,
celebrities. You know, they
what would
become
you do if you had a parent come in who was saying, "Oh my gosh, my daughter's nose is so awful. Please fix it." Or my daughter is, horribly overweight. Please fix her. I'm just,
sure, sure.
how would you handle that?
Well, okay, so there must always be an insistence on the truth. So, and but we have to offer the truth in love, right? So it's not a matter of beating them over the head with the realities. It's a matter of, first of all, they have to understand that you're there to serve them, to serve their best interest. That's what the Hippocratic Oath is about, but that's also what our sort of our baptismal obligations are about. We are obliged to serve one another out of love. And so they have to have confidence in you that that's what you're there for. They have to understand that you're not some sort of a political agent that's there to deny them happiness. They have to understand that you are, in fact, a professional, a physician, surgeon, who has their best interest at heart. You have to win a friend. So I put that sort of at the center of the whole therapeutic process is that this sense of collaboration and the sense of filial love, right? And okay, so having done that, we then they then have to have confidence that I'm speaking objective truth. So in the case of an anorexic, we do a body mass index, right? You can do an immersion body mass index, or you can just do simple measurements. You know, you're 5'3" tall, and you weigh 81 pounds. You can use tables to show the person, well, here's your body mass index, and here is the breakoff point for obese, here's normal for your age and height, and here is below normal, and you show them that they're well below normal, remembering, of course, that you're dealing with this delusional thought. So the
So they
patient,
might just hear you and think,
yeah,
well,
exactly,
that might be true for some, but it's not true for
not
me.
true for me, yeah, but
You're
that's
just not
why.
seeing the fat.
Exactly, exactly.
Yeah,
But that's where the family dynamic comes in, because
right.
the patient may have the delusion, but we have to hope or expect that the parent does not. That the parent is seeking to bring happiness to the child, but hopefully when you present the objective evidence that a body mass index of 5 is anorexic, when they hear that, when you show them in the textbook, that they'll understand that, and then you can start having a discussion with them about, usually when young girls have these thoughts about themselves as being obese, because they have this sense of isolation, they have this sense of not being integrated, it usually has something to do with a sort of a wounding event that may have occurred at such and such a stage in their life. We need to sort of explore that, but we have to be absolutely clear that you don't do liposuction on anorexic, just as we have to be absolutely clear that you don't do genital mutilation on children who have confusion about what their sexed self is, right? The family has to understand that there's a dynamic involved here that's causing a tremendous grief in the heart of their child, and the child is trying to manage that grief with this new thing. When they talk about themselves as being the other sex, everybody gets excited, everybody gets affirmative, and suddenly they don't feel anxious anymore. You
And
see
they
how
have
that.
all sorts of support and love and
Exactly, exactly.
affirmation.
And they become local celebrities, and in school they become especially celebrated in this whole thing, and
Well,
you
and that sort of brings me to this other issue that really concerns me. That a lot of times these children are encouraged or coached or groomed to say that they're suicidal and that they need these
right,
interventions or else they're going to kill themselves.
right,
And first of all, I feel like um, from my perspective, if I had a child threatening suicide, I would immediately get them psychiatric help,
right,
probably put them in an inpatient unit if I
right,
felt like those threats were serious.
right.
And yet, doctors are now saying, oh, well, if they're suicidal, we better give them what they want. And I'm just wondering, from your perspective as a doctor, what does that do?
Yeah, and so what you've just described is the opposite of normal preoperative consent. If I had a patient who I'm consenting for surgery, And I had the sense that they were so psychologically stressed that they were threatening to take their own lives. I would consider them incompetent to give consent for surgery. And yet we're calling that the reason for consenting them for surgery. So it's a complete reversal of the truth, that because they're so out of their minds with grief about their sex appearance, we're going to allow them to consent for surgery. It's completely the opposite of how it should be managed. The problem now is, though, because it's become politicized, if you even give a whiff of an idea that cross-sex self-identification is a psychological problem, odds are you're going to lose your license to practice medicine.
So have you had any ramifications? Because you have been speaking out and you have been testifying, and I'm very grateful for that, because I'm involved with this based on my experience of having a trans identity as a kid and accessing appropriate psychological help. Thank goodness. Now
Praise
that's
God.
banned in my state. So if I were a child now, I wouldn't be able to access that, which is
Right.
just, to me, heartbreaking.
Right.
But for me, I'm coming from a very different perspective than you are. You are risking by speaking out. Your risk, and I'm wondering, what have you experienced as a result of it?
I don't, I don't see a lot of risk in it. I mean, maybe I'm going to prove to be, a fool about the whole thing, and then find my life in a smoldering wreckage. but the way you have to look at it is that if you suffer for the truth, well, that's not a bad thing. That's a good thing.
Well, and I feel like it's
That's kind of
so
what we hope to
important.
do, right?
Yeah, and I feel like, especially now, as I'm seeing the news about coronavirus and all the questioning that's going on, I feel like it's so important for doctors to maintain and uphold truth.
Yeah.
Because if they don't, if they're subject to these political pressures, then we get really confused as a society, and it can be incredibly dangerous.
Oh, it is. No, it clearly is. The whole, well, the medical community has become very politicized because there's now so much money in healthcare. It just within the span of my lifetime, which, I look old and I am old, but I'm not all that old. I've only been a doctor, like I say, for somewhere hovering around 40 years now, starting in medical school. In my lifetime, the amount of money in medical care has gone through the roof because the government got into healthcare, and because there's all of this grant money around now, and grant writing is a political process. So if you speak the right political words, you get piles and piles of money. And if your research publications support the political agenda, you get bigger and bigger piles of money. uh, the present situation with COVID and Dr. Fauci and what have you. If you look into the history of Dr. Fauci, he did exactly the same thing with the AIDS epidemic. He convinced the world that AIDS is a disease that could affect anyone. And so he got us all losing our minds testing for AIDS in everything and everywhere, when in fact,
Well, at the
98,
same time, not teaching people to curtail the very behavior
correct.
that would expose them to it.
Correct. I mean, the scientific truth of it was that 98.8% of all AIDS cases were in sexually active males, typically sexually active
Completely
males practicing
preventable.
receptive intercourse with
Mm.
other men. Yeah, and so, but that you weren't allowed to speak about that. All they would do is they would trot out that one poor little girl who got a blood transfusion when she was in the hospital in Amsterdam and now has AIDS, and they play the Sarah McLachlan music, and everybody is in tear filled, and AIDS is a disease of all people, and it's not, you know. But we're hearing the same thing now. It's why? Because you get money, you get money if you say the right things.
And
Uh,
so as a doctor, how do your colleagues respond to you when you start speaking about the transgender issue? Because to me, it's mind-boggling to me. I went to a Senate hearing recently at the Utah State Capitol, and doctor after doctor after doctor from the gender clinic at the University of Utah stood up there and said that we had to affirm these kids, that it would be horrible not to, that we needed to provide them with these medical treatments. And they said it with a straight face and conviction. And I was astonished. It's one thing hearing an activist say that, but
Right.
to hear actual doctors say that, it's
Yeah.
astonishing to me. And yet you're the one who's sort of the anomaly here.
Well, it's not, I'm not so anomalous, really. You know, you can find a clear explanation for who affirms and who denies this whole transgender mythology. If you just look at the bank accounts, I mean, that will more readily explain everything. I
Which
went
is
to a plastic,
just so
I went to,
sad. Like in my mind,
well,
I keep thinking there's maybe
I went to a plastic surgery conference in California, the California Society of Plastic Surgery, about 3 years ago, I guess it was. And the whole of the Sunday session, it was one of these weekend ones. It starts on Friday afternoon and finishes up on Sunday afternoon. The whole of the Sunday morning session was on transgender surgery, and one whole, I think probably about 45 minutes of it was dedicated to how to compel insurance companies, how to compel public insurers, how to compel the government to provide funds for transgender surgery, right? And I did my general surgery training in the Bay Area, and a lot of the guys who were there are guys I know. When you know, University of California, San Francisco, East Bay program, UC Davis, that's the whole world I trained in. Some Stanford people were there, and we'd see each other at
these are
meetings and
bright
stuff.
people.
Very bright people, much brighter than I am, by the way. But you know, I remember having this conversation with one guy who was there, who was actually a presenter, who gave a presentation about how to bring transgender surgery into your plastic surgery practice, how to make a success of it, you know. So during the break, I sort of called him aside and, you know, recalled old times. Remember when we were doing neurosurgical trauma at San Francisco General, and we are having some laughs and stuff like that. And I said, you remember when we were in training how, you know, ulcer surgery was the biggest thing you could do as a general surgery resident? It was like the premier case you get to do as a chief resident, is to do ulcer surgery on somebody, and to do a vagotomy and a pyloroplasty and all these surgeries that had names and stuff like that. And I said, and look at us now. Ulcer disease isn't even a surgical disease. You give people a couple of pills and their ulcers are cured. I said, did it ever occur to you that maybe this whole transgender thing you're into is in that category? That you're doing something that's going to be proven to be utterly
Harmful in this
harmful?
case, like a
Exactly.
lobotomy.
Yeah. At some later date, and he got kind of silent with me, and he's kind of looking away from me. He's not looking at me. So the people who have a financial stake in it tend to be kind of squirrely like that when you confront them with the realities we've been talking about. But if you talk to the generality of physicians, you know, like in the doctor's lounge, and if I'm at the local hospital or what have you, most of them actually get a look of complete relief on their face, because the world has been sort of convincing them that you're out of your mind and you're not a good doctor if you don't believe in transgender ideology. And yet in their hearts, they know that, no, that's not what the human person's about. And so when you give them the logical explanation, which they have known in their heart all along, and you reaffirm them with the facts, they get a sense of confidence about it, and they go, yeah, no, that's right. I kind of knew that. I kind of knew that. And so it's an odd thing. But the problem is that the guys who are doing the surgeries, or who are giving the puberty blockers, or they have tremendous political patronage at the highest levels of the economy and the government. You have huge donors, from software manufacturers to, you know, bankers, media companies, and of course in the government, because that's the way government works now. So the foe that's arrayed against the truth is a pretty
And
considerable
it just
enemy.
makes me so frustrated, because there are true medical conditions that we could be treating right now. There's
Oh,
research we could be doing that would
sure,
benefit humanity.
sure.
And there's people who in Flint, Michigan, who don't have clean water, and we could be using these funds to really benefit humankind, but instead we're using it to harm children, and to me that's unconscionable.
Yeah, there's no question about it. There's something diabolical about it, even, wouldn't you say?
I would say it's very disturbing. And again, I
Yeah,
think back about myself as a child,
yeah.
and if I had been affirmed, I have no doubt I would have been ecstatic to get on those puberty blockers, and I would have
Oh,
had this built-in community.
oh yeah,
I would have had friends. I would have had
sure.
advocates. And the thing that bothers me the most, I recently, well, I guess as of recent, it was about a year ago, I went to a rally to sort of celebrate the local transgender community. And there were adults that struck me as very predatory who were talking. And then there were children, some of whom my kids had played with as children,
Right,
who were there, who are now presenting as gender
right,
nonconforming or
right,
transgender.
right,
And it just broke my heart
right,
because I saw these kids who I know um, are good kids who are now being told that there's something inherently wrong with their body, that
right,
they should hate who they are so much that they want to change themselves with these
right.
interventions. And it's these adults who I really get a sense that they're predators.
Grooming behavior. It's definitely a grooming thing. So first of all, just the idea of an adult talking to a child about their sex life, a decade ago would have landed you in jail, but now it's considered, a
Now you
public
get to have
service.
a speech on town hall. I
Yeah,
mean,
you get to have, like, drag queen story time in public libraries, right? And that's considered a great thing, and it's announced on public radio that they're going to have drag queen story hour. But the idea of speaking to children about their sex life is the beginning of it. It's a grooming sort of process. If a 14-year-old child can consent to a mastectomy, or if a 11-year-old girl can consent to cross-sex hormones, then it's a really short step for that same child to consent to sexual relations with,
and
say, a
actually,
seven.
that's what first got me concerned about this because
Right,
I started seeing the drag kids and I started thinking about consent. And I actually, really explored consent a lot. And it really struck me that the whole goal of a lot of these activists was to lower the age of consent, lower and lower and lower. You teach children that they're capable of making these rather profound medical decisions, and if they're capable of doing that, then
right,
why aren't they capable of consenting to sex with
right.
whomever they want?
This whole empowerment thing, and at the heart of it is the destruction of the human family. Okay, so you had your first wave feminism that was about the dignity and rights of women, women's suffrage, and all of those things. And all those first wave feminists were big pro-life people because they knew that contraception and abortion were a way for men to manipulate women, and they knew that their freedom lay in their dignity as women, and the completion of their dignity, which really is a Christian contribution to human life. I mean, the idea that God is no respecter of persons, slave or Greek, male or female, and so on. That finally made it into the public arena and said, yeah, women are politically, not just spiritually, it's not just but politically equivalent to men. First wave feminism, right on. The problem is that in the era of contraception, with the separation of the sexual act from its reproductive consequences, this idea of liberating women from the natural consequences of their sex life, and the idea that women really didn't even need men around to raise children, that if they chose to have children, they can have children, and that sex has absolutely nothing to do with reproduction, that they're two separate things that occasionally overlap. That whole idea of sexuality, as now that you're into the third wave of this whole thing, sex is really all about personal political expression now. And that's a terrible way to look at the human person. As we talked about earlier, the fullness of the human person is that they are made for the other. They are made for the total gift of self that is so complete that it gives new life, right? That the human sexuality is about this unity that is fruitful. and lifelong between a man and a woman. That's in our nature. But if you really wanted to understand a human person, you don't sample one person. You get a whole family. You get a man and a woman and their child or their children. That's the human person. That's what it
Well,
looks like.
and I
And
think that
and so at the heart of this attack, and this is the reason I have no qualms about calling it diabolical, is it's an attack on the integrity of the human family
well,
and the
and it
set.
starts with the idea that there isn't an inherent difference between male and female,
Right, right.
which is ironic because now the radical feminists are very upset because men are saying that they're women and using the very arguments that were used in order to kind of push the radical feminist ideals.
Yeah, exactly. All those title, was it Title IX,
Right.
sports
And
related things. Yeah, suddenly they worked so hard to get women's athletics as a separate and funded and supported and encouraged thing, and it's now being taken over by a bunch of guys with weaves on their heads, and yeah, and if ever there was evidence for the fact that men are different from women, you realize, and I bring this up when I give this presentation, particularly in the high school age kids, they all say, well, male and female, it's the same, it doesn't make any difference. I point out this fact that if you were to look at the the International Olympic track and field record for all the track and field events by women, right? Olympic records, women. All of those records are beaten by high school age boys. The boys' high school athletic records break every woman's track and field Olympic level record. You're talking about women who train for like 6 to 8 years to be in the Olympics, and you're comparing them to boys who, like, during recess and after school, practice hurdles. You know what I'm saying?
well,
The
and that's
boys.
where
So
the media has done such an amazing job, because I'm not sure if you're aware, Idaho just said that males are now not allowed to participate in female sports. That's the law. But the media is saying transgender are no longer allowed to compete. And that's not what the law says. It says biological males need to compete against biological males.
correct.
But the media, again, it comes to the language. Media is spinning it and saying Idaho has passed this law that transgender athletes are not allowed to compete, which sounds horrible. Of course, we
Right.
don't want to
Sure.
like discriminate against this group.
Right.
But and that's where I guess the importance of people like you, and that's one of the reasons I'm doing these interviews, is just to get more information out, because I think
Yeah.
that the activists have done a really good job of pushing their side of the narrative.
Sure.
This idea that we need to be compassionate and loving and caring, and these poor kids are born in the wrong body. And
Yeah, and so you got to just drag them right into a conversation about, what do you mean they are born in the wrong body, and
right.
can you tell me of any person that you know? Tell me of any person that you know that you would know if you didn't know that they had a body. I mean, everything I know about Aaron Brewer, I know because I have had contact with you. First of all, in Alabama, and now because you're an embodied person whose voice I hear, right? We don't know of any person were it not for the fact that they are
They are
embodied.
in their body. And
Exactly
I
right. Yeah.
also feel
So
like in some ways it's incredibly kind of a really heartless message to suggest. I mean, I think about people who have debilitating disabilities that are in bodies that are very difficult to be living in. And then for someone to say that you could be born in the wrong body, it just is such a strange narrative to me.
right, and it's
And I've
not the
really
truth.
tried to wrap my head around it. And I think what you said was the most kind of compelling, the idea that there's this gendered spirit that inhabits a body and may or may not pick the right body. Um,
Right,
is just,
and you see that in a number of different things. I hope I don't offend anyone here, but it's the one of the current ideas in the modern mind is the idea of the body as something that you possess, that you as a person are your soul and your thoughts and your mind and your ideas and things like that, and you have a body, and you have a body over which you have rights and over which you can exercise dominion and domination. And transgender is about the domination of your own body. Viewing the body as a thing separate from you, the person, rather than what has been our understanding for about the last 3,000 years, that the human person is a hylomorphic creature. Hylomorphic, the Greek word meaning hylomorphic, meaning spirit body, hylomorph together, forming a single nature. It's not that you have a spirit nature that occupies a body, and it's not that you are a body that has a spiritual quality to it. It's that together they form a single nature. That's what human nature is. But yet the way the world speaks these days, and we see it a lot in plastic surgery, is that people speak of their bodies as something that they own, something that they can dominate, and something that they treat like a thing, like they're remodeling a kitchen, or they're modifying a car or something like that. And the piercings and the body changings and the tattoos and all of those things. Again, I hope I don't offend anybody, but it's the sense of the body as not being
Separate.
you, but something that you own,
Well, and
right?
I think that it's really astute, because I know that when I was a kid, I hated my body. I blamed my body for having been sexually assaulted. It was like I was something separate from it. The body did it, not me. The body was assaulted, not me. And it was the body's fault, not mine. And so I think that a lot of these kids who have these hurts, these traumas, if they can separate themselves, it's a way of sort of healing,
Right,
because then it's not their fault, it's their
right,
body's fault. And
right.
so I see a lot of, and that's where what concerns me is a lot of these kids actually have an incredible degree of self-hatred.
Yeah,
They hate their bodies, and they're being encouraged to hate their bodies, but we know that when people are healthy, there is that unity between body and self.
right.
And that's
Yeah,
what's so sad, is that we're encouraging that separation.
that's right. That interior separation, that interior division, that's that's your story. The story that you just very bravely related to us is pretty much what we've been talking about. This wounding event that causes the child to see their body as the cause of their lack of safety. Bruce Jenner used to be mercilessly treated by his father when he was preparing for the decathlon. Got these, beautiful sisters that the father dotes on, and they don't have to suffer like he does.
Oh,
And yet his
interesting.
father's just flailing on him to get his decathlon performance up to Olympic levels. And you can imagine that in his heart, he must have thought that, gosh, if I'd just been like my sisters, I wouldn't be suffering like I'm suffering. I don't know. This is a hypothesis on my part, but your story is the kind of story that's kind of characteristic of, and not just for trans stuff, but even the other things that we were talking about, like the man who comes to the office who's practically in tears because he thinks that the reason he is unhappy is because of the appearance of his nose. Because yeah, there's always some wounding event that underlies this desire to find a physical explanation for their sorrow, and
Well,
you
and you can
cannot
really
you
see
cannot
that.
heal. Yeah,
Yeah,
you cannot heal an interior wound with external surgery. Okay,
right.
sounds obvious, doesn't it?
Well, and you
But that is
see
the
these
case.
people who they keep trying to pass, and
Right,
the more they can pass, they just think, if my voice will just be better, if I can just get breasts, if I can just
right,
change more, if I can just change the right way so that society perceives me a certain way, then I'll
right,
feel better. But even Johanna Olsen Kennedy's
right,
partner, she's for people who don't know, she's one who does mastectomies on 13-year-old girls and gives cross-sex hormones to 8-year-olds, really young.
criminal.
um, and her partner is actually a transgender individual, and even related the fact that despite going through all the surgeries, despite completely passing as a male, the gender dysphoria never goes away. And it's because you're trying to chase something and you're never going to get there. And that's where,
Correct.
what you said is, if somebody comes in and wants to sort of maybe augment their appearance a little bit versus the idea of trying to run away from themselves and their
Right.
very being.
Yeah. At the heart of this, is this appeal for charity. When they start speaking about the suicidality of children who have cross-sex self-identification, when they talk about the way that trans people suffer in public life and so on like that, this is an appeal to charity. And charity is a very important word. Because it's a very Christian word. It's been co-opted by the world to mean other things. Now charity means, well, I wrote a check to the United Way during halftime of the Super Bowl, and so I'm being charitable. But really, charity is a gift of self that is based in the truth. Why do I say that? Because charity without the truth is not charity at all. It has to be the sacrificial gift of self, that you're willing to suffer for the good of the other person. That's true charity.
Mm.
And charity is based in truth. There is no charity without clarity. Charity, the Christian definition of charity, is perfection in the love of God, which implies perfection in the love of neighbor. Because he said, as St. Paul said, or St. James, how can you claim to love a God you don't see when you don't love your neighbor who you do see, right? Yeah, so we know that charity, the love for other people and the self-sacrificial love for other people, is an expression of our love of God. So charity is perfection in the love of God, and it has its basis in truth. And we as Christians understand truth not to just be a collection of principles or theorems or ideas or equations or anything like that. Like you open the file drawer and here is truth, right? There is objective truth like that, but ultimately we know the truth to be a person. The truth is a person. He told us so. He said, I am the way, the truth, and the life. And no one comes to the Father but by me. Well, the truth is a person in whom we believe. And so for us to encourage somebody to believe a lie is really to deny what is at the heart of our life of faith, right? A faith that impels us to charity, which is perfection in the love of a God in whom we believe and whom we know to be the truth. And if we don't serve the truth, we've abandoned the most fundamental requirement of Christian life.
Well, and of humanity, really,
Yeah,
because as you were
right.
speaking, I was thinking, what if an alcoholic came and said, I need you to affirm me because I don't want my feelings hurt for my behavior? And if we were, okay, well, we'll tell you it's okay to drink, it's okay to drive drunk, it's okay to cause those accidents.
God made you that way. Yeah.
God made you that way, and we don't want to hurt your feelings. Yet real love is to confront somebody and say, I love you,
Right.
enough to say your behavior is harming you, or
Right.
your behavior is harming somebody else.
Right.
And so as we have activists who are saying we have to, this is tolerant, or this is loving or charitable, we have to really call that out and say that's not true,
Not at
because
all.
this is causing people to hurt themselves.
Correct. Correct. And we now have an abundance of evidence that shows us that transgender therapy, including medical therapy and surgical therapy, does not serve the interest of the person. You pointed that out with Olson Kennedy's partner, but we see it in probably what is one of the best, most comprehensive studies of the long-term effects of transgender therapy, which came out of Sweden. I think the year was 2013. But Sweden is a very important demographic, because medical care in Sweden is governed through a single database. Every episode of medical care in Sweden gets entered into the same database, whether it's a prenatal visit from the mom, and that prenatal visit identifies this human person that's in her womb, that's called baby A or whatever, ultimately is just given a name. From that moment until, it's like the pronounced dead in the hospital, every episode of care, whether it's the school clinic or the public health clinic or the prison dispensary or the psychiatric hospital or whatever it is, everybody is in the same database and the same language is used in the same database. And why is that important? It's because I can look in that database and I can find perfect uh, cohort or a match for any transgender person. Like, say, for example, I've got a 34-year-old, second in the birth order, from a middle-class family in a large urban environment, who was assigned male at birth and is now fully transitioned to female. And I can find another person in that database that is 32 years old, second in the birth order, blue collar background. And then I can compare these two people and say, well, what's the likelihood that one's an alcoholic and the other's not? What's the likelihood that they've been incarcerated for violent crimes? What's the likelihood that they've tried to harm themselves? What's the likelihood that they're abusing drugs or whatever? I can compare those things.
Which is
If you look at
ideal.
if you
That's
look
like
at
the
the long-term
perfect
data, it's a
situation
perfect
for
database.
research.
Yeah,
Yeah.
it's a perfect database. If you look at that and you look at the long-term outcome study there that you get from that, what you find is that fully transitioned persons have a 19 times higher likelihood of suicide than the matched cohort, right? Whether you match them for natal sex or the sex at birth or the sex that they've transitioned to, it doesn't make any difference. 19 times higher suicidality rate. If you take the subgroup of women who have transitioned to male, that risk goes up to 40 times higher, right? Well, why do people think that transgender medical care, transgender surgery is lowering the suicide risk of people? Well, it's because they've been looking at these little short-term studies of, 30
Self-reporting,
yeah,
self-selected,
self-reporting,
self-reporting.
self-selection, people dropping out from follow-up. I mean, in Sweden, if the person doesn't return for follow-up, they can be tracked down and go, oh, look, they took their own life 5 years ago. Well, the guy in San Francisco who's publishing the paper that says, oh yeah, people are very satisfied with transgender surgery. Well, the bad outcomes they don't know about, because the bad outcomes don't come back for follow-up. So it's a self-selection bias. And if you only follow them for a few years, it looks like you've done them some good. It is the case, like even in the Stockholm paper, if you look at them for about 5 to 7 years, the suicide rate is comparable to the general population. But suddenly when you get out beyond about year 8, the bottom starts to fall out. Why? Well, because the excitement is gone. Now, all this affirmation that they've been getting, well, people are sort of bored with affirming you in your new identity, and it's not a big deal to anyone anymore. And there you are. You still have that wound that Olson Kennedy's spouse has. That interior sense of themselves hasn't changed. But now what you have is a person with an internal wound whose genitals you've mutilated. That's really all you've gotten for it.
And you've messed up their hormones.
You've created a counterfeit. And so the suicidality returns. And that's the problem. If somebody ever says, oh, there's a recent paper that says that transgender medicine lowers the suicide rate, the first thing you do is you open up that paper and you go, how long did they follow these patients? If it says, 30 patients were followed for 6 years, you can go, sorry, that ain't science. Show me what happens to these people 18 years out, right? And what you see is what the Swedish study has shown us. And by the way, you can't blame the data from Sweden on the closed-mindedness of the Swedish people, because they have been LGBTQ affirming since before the Norse invasion of England, for crying out loud.
Yeah, they're the most socially accepting
Sure.
probably community there is.
Yeah.
And it's interesting that you say that about longitudinal studies, because I think that people don't realize how important those are. Walt Heyer, who went through the full medical transition, and Billy Burley, I just spoke to him. They talk about this initial euphoria that they feel because they, it's like, oh, and they get all this affirmation. They feel like they've made these changes. But then Walt is saying that he's hearing from lots and lots of people 10 years out who are just devastated, because not only is that internal wound still there, their self-hatred has been affirmed by everybody in the community. And now they've got all these medical problems that they're dealing with. And it's just heartbreaking. Yeah. So those longitudinal studies are really the only studies that we should be looking at.
One of the things I'd like to...
we probably need to kind of wrap up.
Sure.
Is there anything that you sort of would like to share that you feel is important that we haven't covered?
Well, one thing that we haven't covered that's very important to understand is that unfortunately my specialty of plastic surgery is in the habit of giving the world the impression that we make perfect things, that we do in fact make silk purses for a living. There is no plastic surgeon that can turn male genitals into female genitals. There's no plastic surgeon that can turn a free flap of tissue into an actual penis. All of those surgeries are mutilating surgeries that destroy a natural human function for the sake of creating a counterfeit structure. All you're getting is a counterfeit structure that suffers from complications. When
And
you
the complications are just horrible.
they can be pretty horrible. I mean, if, for example, a female to male, just the complications with urethral lengthening so that they can urinate while standing up, urethral cutaneous fistulas, urethral obstructions with bladder distension problems and kidney injuries, and repeated surgeries required, or the creation of artificial vaginas for receptive intercourse, and the tendency for those things to collapse and scar down, or bowel injuries that occur when you attempt to use the bowel as the receptive structure. And what you're doing is you're relegating this person to a lifetime of medical care. So every child that gets enrolled into this process is basically being consigned to a lifetime of dependence on the medical system, whether it be for hormonal support or repeated surgeries to solve the problems with urination or bladder or kidney injury or bowel injury or
And this
infectious
is not a
complications.
normal developmental path
This
to
is
have
not
this
a
kind
normal
of
developmental path.
ongoing
And what you
medical
get at the other
attention.
end of all of this surgical care is you do not turn a man into a woman or a woman into a man. What you're doing is you're creating a counterfeit. And it's very interesting, and you pointed this out earlier, is that people try to pass. They try to pass as the other sex. This is the same language that counterfeiters use when they're passing counterfeit money. I passed a $10 bill that I made. Because it's the case. All that you're doing is you're creating counterfeits, right, in the hopes that you're going to solve an interior wound.
If you
Which
trick enough
clearly,
people, maybe which is really convoluted. It's a very sad message to give to someone that if
yeah,
you can trick other people into accepting your delusion, then
yeah,
you'll feel better.
you've succeeded, yeah. And
Yeah,
that's a tough way to live.
it
Tough way to
is.
live.
Well, thank you so much for sharing your expertise, and I really appreciate your willingness to stand up for truth and to really challenge your colleagues and to talk about your experience.
Well, it's been a pleasure seeing you again. I really enjoyed our interaction there in Montgomery, Alabama, and hope to see you again sometime soon. And God bless you for your hard work on this area with your personal witness. It's a very important thing. The personal experience side of this is probably the most important thing, because
And
ultimately
that's
that's one
where
of
I'm so thankful for people
yeah.
like Sidney Wright and Billy
Oh
Burley
yeah,
and
yeah.
Walt Heyer,
They're my heroes.
talking about their
Yeah,
experiences.
yeah, yeah.
But it's also important to have a medical
Sure.
perspective because we need to know what is the medical truth of this. So
Yeah,
thank you.
yeah. My pleasure.